More than 923,000 adults in Michigan are diagnosed with diabetes. That's 10% of the state's adult population. This chronic condition is one of the most pressing public health challenges in the state. Mary Cunningham, a senior provider program specialist at Priority Health, is here to talk about how Michiganders can take control of their health during National Diabetes Awareness Month. Thank you, Mary, for being here with us. You know, when I heard that stat there, I was a little shocked. Just tell us a little bit more about the burden of diabetes in Michigan.
Well, as you said, almost 1 million people are diagnosed with diabetes. Another 230,000 have diabetes and don't know it. And so that's 12% of the population have diabetes diagnosed. 37% of the population has pre-diabetes, which puts them at high risk for developing diabetes within 5 years.
Wow, that's kind of a frightening statistic. What, you know, we hear about the different types of diabetes. How many are there, or what briefly are some of the differences?
Type 1 diabetes usually occurs in children and young adults, although it can occur at any age. It's an autoimmune disease where the body destroys all the cells that make insulin. So people with type 1 don't make insulin, so their only treatment is insulin. Type 2 diabetes, which is about 98% of all people with diabetes, is more slow onset. It starts over time. There's usually no symptoms. It's heavily genetic. So people with parents or siblings with type 2 diabetes are at high risk for developing diabetes. Gestational diabetes occurs in pregnant women, and typically it goes away after birth. Hormones cause some insulin resistance. That goes away after birth. However, they're at high risk for developing type 2 diabetes later on in life.
Interesting.
And again, Mary, thousands of people in Michigan have diabetes, but they don't even know it. So what can we do about that?
I highly recommend going to see your provider. If you haven't had a physical or blood work done, I highly recommend, especially people over 40 need to be tested for diabetes, but really getting in with your provider. Also, you know, reach out to your health plan. Priority Health has lots of great programs to prevent diabetes, and also if you have diabetes, and a pretty robust care management team.
One of the things we've talked about repeatedly during this segment, and that is you have to have a good relationship with your primary doctor, because they can help guide you through this. But for people who maybe don't have that relationship, don't go as often as maybe they should, what are some of the common symptoms and signs of diabetes? Not that we should be self-diagnosing, but we should be self-aware.
So for people who have type 2 diabetes, again, there's no symptoms. However, if blood sugar gets really high, people become very thirsty, unquenchable thirst, weight loss, fatigue, and they also urinate frequently.
Okay, so it's getting cold out there, right? So talk about some of the challenges people face staying active during these winter months and how they can overcome that.
Well, the days get shorter, less light. I think we hibernate in Michigan because there's not a lot of light. I think lots of things. You can do home workouts, virtual workouts. You can bundle up and go outside for a brisk walk or try a winter activity like snowshoeing or cross-country skiing. Walk at the mall. Lots of
walk at the mall. That's a good one.
You know, there are other things I guess you could do, lifestyle changes or lifestyle adaptations that people with diabetes can do. What are some of those?
We know that people can prevent diabetes by doing 2 lifestyle changes: losing just 5 to 7% of their weight and doing at least 30 minutes of moderate activity at least 5 days a week. Those 2 lifestyle modifications have shown to cut your risk by 58%.
Wow.
Oh, okay. Mary, anything else that you want to share that we missed?
No, I don't think so. Just a shout out to Priority Health care managers. I'm on that team, and you know, again, make that appointment. See your primary care provider and talk about diabetes.
Yeah, continue that conversation.
So much.
Thank you, Mary. Appreciate it.